morning. Thank you for coming along. I've been joined by Naomi Bromley, Deputy Secretary from the Department of Health, in charge of the vaccination rollout to update the Victorian community on the COVID-19 situation today. So yesterday, as we've already reported, there were 1,612 new cases of COVID-19 in Victoria. All cases were locally acquired. That brings us now to 19,012 active cases of the virus in our community. Tragically, we had 8 people lose their lives in this reporting period from COVID-19. They were a woman in her 70s and a man in his 60s from the Darebin area, a man in his 40s from Port Phillip, a man in his 80s from Maribyrnong, a man in his 80s from Brimbank, a man in his 70s from the City of Melbourne, a man in his 70s from Glen Ira, and a woman in her 70s from Whittlesea. Can I take this opportunity to pass on our condolences to the family, the friends and the communities of those Victorians. Our thoughts are with you at this very sad time, and our prayers are with you as well. In regards to hospitalisations, there are 677 people currently in hospital with the virus. Some 133 are in the intensive care units across the state, and 94 of those 133 are on a ventilator. In regards to tests and vaccine numbers, yesterday we saw 73,138 tests carried out. We also, through state-run clinics on Sunday, had 34,279 vaccines distributed through those hubs, and a total, by the time you add up our GPs, our pharmacists and others, for a Sunday extraordinary number of 81,000 vaccines delivered across the state. A few things to announce today. With vaccine supplies now being increasingly assured, and particularly with young Victorians, especially in that 12 to 16-year-old age group, who only came on board to be eligible less than a month ago, and the extraordinary uptake of vaccine levels in that group, today we can just confirm that mRNA vaccines, Moderna and Pfizer, will be available to people of any age through our state-run vaccination centres, not just those under 60. So essentially now, as we push towards 70 and 80% double dose and beyond, it's time to throw open the doors of all of our clinics, more than 60 of them are across the state, to the mRNA vaccines, particularly Moderna and Pfizer, for all comers. This change, which is now in effect, has been made possible by the relative certainty that we now have for both Moderna and Pfizer, and the extraordinary number of young people who have come forward over the past 3.5 weeks. In fact, Victoria is well on the way to becoming one of the world's most vaccinated jurisdictions. As of yesterday, we were sitting at 86% of Victorians aged 16 and over had received their first dose. This includes 93% of people aged over 50 and more than 95% of people aged 70 and over. And indeed, that age group between 12 and 16, 64% of that group are now single-dosed, and an increasing number of them are in fact double-dosed. And just reflect on the fact that less than a month ago, that group became eligible. So I want to thank those young people and their families and carers for stepping forward in such an extraordinary rate of support for the vaccine program. So Victorians 60 and over can now book to receive Pfizer or Moderna at any one of Victoria's centres right across the state, more than 60 of them, and there is no reason not to. These are our processes of getting to 70 double dose, 80 double dose, and in fact pushing well beyond. That also means that when it comes to the walk-up programs for mRNA vaccines that we had in place last week, that we'll be making those essentially permanent from here on in as we push to that 70, 80 and beyond double dose. So you can now walk up to any one of our major vaccination centres for your highly effective mRNA vaccine, be it Moderna or Pfizer. And just to refresh the community's memory, that includes the Sandown Racecourse, the Bayside Centre in Frankston, the Barry's Road Melton vaccination site, the former Ford factory in Camberfield, the Royal Exhibition buildings, the Melbourne Convention and Exhibition Centre, the Sunshine Hospital Vaccination Centre, the Plenty Ranges Arts and Convention Centre, La Trobe University Bundoora, the Eastland Shopping Centre, the Shepparton Showgrounds, the Terrelgan Racecourse, and the Kia Review Military Barracks in Mildura. We can also announce that with Victoria preparing to open in time for summer, based on our implementation of the National Plan for Reopening, we will also be launching today a new campaign to remind everyone that your vaccination is your ticket. The new vaccination campaign is to run on all platforms, TVs, radio, print, online, and it's all about capturing the sentiment that Victorians want to get back to the things that we love, the things that we aspire to again after 20 months of such hard work. Dining, sport, travel, work, but perhaps most importantly of all, reconnecting with family and friends and those that we love. As announced as part of the Victorian roadmap to deliver the National Plan, and in order to protect the community and our health system, we know that the safest way to do that is to apply those measures to Victorians who are vaccinated. So if you're not vaccinated, these freedoms won't apply in the same way as they will to those Victorians who are vaccinated. And more importantly, every unvaccinated Victorian, particularly those who do fall susceptible to COVID-19, they are far more likely to get seriously unwell, they are far more likely to require hospitalisation, and tragically, through the fatality figures that we are seeing, far more likely to lose their life to COVID-19. And that particularly applies if you are an older Victorian. So please, if you have yet to get vaccinated, come forward and look after yourself, look after your community, and do your bit to support our health system and get Victoria open safely and sustainably. I might ask Naomi to take us through some of the details of both the map of the outbreak and some updates on the vaccination program, and then we're happy to take questions.
Thank you very much, Minister. Yesterday in the northern suburbs, we saw 499 new cases, which was 31% of all cases. Pleasingly, we are seeing a stabilisation in Hume, which had 169 new cases yesterday. Now, in previous weeks, we know that we have seen Hume recording up to 300 cases a day. I think the dramatic increase in vaccination rates in this area has gone a long way to helping us bend the curve of the infection in this area. Hume's now up around 85.6%, so our thanks and gratitude to the people of Hume. In the West, we saw 427 new cases, which was 27% of the total new cases. In the East, there were 95 new cases, and in the South East, there were 459 new cases, which is 29% of the new cases. Now, the city of Casey had the highest of any local government area yesterday, with 174 new cases, and neighbouring Greater Dandenong had the fourth highest after Hume and Whittlesea with 109 cases. Now, we have been expressing concern about the southeastern suburbs for a few weeks now. We have been standing up additional testing and vaccination capacity in that local area. So this includes a new drive-through on Thompson's Road in Cranbourne, which is opening up today. This site has capacity for an additional 2,000 tests a day, which will really greatly improve access in that area. That brings the total number of testing sites in Casey to 7. There are also 2 state vaccination centres, and in Greater Dandenong there are 4 testing sites and an additional 2 vaccination centres. So if you live down in the southeast, if you have symptoms, please do go along and get tested. If you're feeling well and you haven't been vaccinated yet, now is a great time to do it. In regional Victoria, there were 122 new cases, which is now 8% of the total new cases. This includes 18 cases in Bawbaw, 16 in Latrobe, 15 in Greater Shepparton. Concerningly, 36 new cases in Mildura, which is of course currently in lockdown, and this brings the total in Mildura to 90 active cases. Yesterday there were 1,600 tests done in Mildura, which means that over a 2-day period 8% of the population has been tested, which is a fantastic effort, and our thanks to that local community and all of the local providers there who have been doing a huge amount of work to boost those testing rates. With regard to the age of positive cases, 22% of yesterday's cases are over the age of 50, and that has been slowly increasing in recent days. This is of course concerning because we know that COVID can have a devastating impact for older Victorians. And this is demonstrated by the 58% of yesterday's hospitalisations being over 50. So of course the best way to protect yourself from ending up in hospital with severe illness is to get vaccinated as quickly as possible. For younger people, it's really important to have that conversation with your grandparents, your parents, your aunties and uncles, and make sure that everyone in your family is protected. Zooming out a little bit, well, as the Minister said, over 86% of our 16-plussers in Victoria have been vaccinated now. That's 72% of the total population have now received at least 1 dose of the COVID vaccine. Now, Victoria is not a country, but if we compare ourselves to some countries around the world, that puts us ahead of countries like the US, Switzerland, Israel, Germany, Sweden and Austria. Now, most of those countries have a higher second dose coverage than Victoria because we're early on in our journey and we're moving very, very quickly at the moment. But we will absolutely get there, and in all likelihood we will exceed the vaccination rates of many of those countries. We know that once a Victorian comes forward for their first dose, they are very, very likely to come forward for their second dose. We have excellent compliance for second doses, and given that our first dose rollout is moving very, very quickly now, it is absolutely within our power to be one of the highest vaccinated areas in the world, which is something that every Victorian should be proud of. The job's not done yet, so if you have not had your first dose, please come forward now and join the 4.8 million Victorians who have had at least 1 dose. If you are due for your second dose, make sure your appointment is booked and ready to go, or make use of one of the walk-up opportunities that the Minister mentioned. Whether it's AstraZeneca, Moderna, Pfizer, that second dose is really critical to get those full benefits. Just a reminder that we have reduced that second dose interval for Pfizer. So if you had an appointment booked in for that longer period, can now change that appointment, come forward earlier at that 3-week point and get your second dose of Pfizer. I'll hand over to the Minister for questions.
Thanks, Naomi.
Today, 70% double dose targets as soon as October 21. What dates is our updated modelling showing that we will hit 70% and 80%?
Well, the roadmap that we released some weeks ago talked about late October, and the more Victorians that come forward to get vaccinated, the sooner we'll get there. So I just encourage all Victorians who are yet to be vaccinated to step forward and get vaccinated. That's why we'll get to 70 and then 80 and beyond as soon as we possibly can.
One of the deaths was of a 40-year-old from Port Phillip. Do we know anything more about that case given their relatively young age?
We've asked for a few minutes. We want to respect the confidentiality of the case, and we don't release details of individual cases, but insofar as if we can release any more information, we certainly will. 40 is tragically young for anyone to lose their life, and especially to COVID.
So health experts have shown concerns with opening up with such significant caseloads in the community. Are you comfortable reopening with the current cases that we're seeing?
Well, we want to make sure that we take the careful, cautious but sustained steps to reopen. That's what the Victorian roadmap to deliver the national plan for reopening is all about. What we have to do is navigate our way between two very tricky processes. On the one hand, deliver the national plan to reopen at 70 and 80% double dose as gateways that we navigate our way through, whilst at the same time making sure that we protect the capacity of our health system to sustain the increased numbers of cases that will bring. And I want to thank particularly our public health community and our health networks for stepping up in such an extraordinary manner to deal with these challenges. We are more than hopeful, but we know that the challenges in that system will be very real.
Is there a threshold, though, that you won't reopen at? If we are at, say, 2,000 cases a day by October 26, will you hold off the roadmap?
Well, as we indicated when we released the Victorian roadmap for delivering the national plan, we accompanied that with the modelling from the Burnett Institute, which talked about a range of measures in which we would expect to see case numbers increase. So far, we remain within that band, and we're confident that on the projections that we've seen and the lived experience that we've seen over the course of the last month or so, that we will sustain those efforts within those bands. Having said that, we do not underestimate the stress and the challenges that will place on both our primary care system and our public health network.
Were you concerned that some older age groups over 60 were perhaps holding out for an mRNA vaccine? We've already got quite high first doses, but what sort of boost are you expecting from that cohort now that you're opening up? And was it based on concerns that they weren't prepared to get AstraZeneca?
Well, firstly, the provision of vaccines is the responsibility of the Commonwealth, and as we've had increased certainty of particularly mRNA vaccines come into the system over the last few weeks, we've been able to nuance our provision accordingly. As the figures that we went through show, the older age groups of the Victorian community who have had access to vaccines for a longer period of time have shown pretty extraordinary high levels of vaccination. When the 12 to 15-year-old age group came eligible under the Commonwealth's program less than a month ago, we took the decision that it was most appropriate to prioritise that group through the state-run clinics because they hadn't had access to the vaccine program. And if we were going to safely reopen schools as soon as we possibly can, we needed to prioritise that group. And that's what we've done. They have more than exceeded our expectations as to the level of vaccination that they have grasped so readily. That's therefore allowed us to now essentially throw open the doors to mRNA vaccines at all points of contact, pretty much, whether it be state-run clinics, GPs, and as the Moderna is available at our community pharmacies, pretty much there are now thousands of points of entry to the vaccination system. So whether you're 16 or 60, and if you've yet to be vaccinated, please come forward. There's bookings there. There's mRNA vaccines with your name on it waiting for you.
Just on mRNA vaccines and with regards to today's announcement, Finland, Denmark and Sweden are limiting the use of Moderna in young people over concerns about rare cardiovascular side effects. So are you concerned about the side effects in young people?
The advice we've got from all of our experts in this space is that the chances of adverse reactions, like any vaccine, are very, very rare, and that particular condition is being monitored, but we've got no advice that it's of particular concern to ration the use of mRNA vaccines. We know that mRNA vaccines are both effective, targeted, and in fact the most effective ones. Having said that, all vaccines that are on the market in the Australian community as part of the Commonwealth vaccine program are effective and safe, and indeed, as we've seen, there's now some suggestion from Northern Europe that AstraZeneca might well have longer enduring protections for COVID. So us people over 50 might have fluked one there.
Are we now expecting to have a surplus of AstraZeneca, given that we've now made the mRNA vaccines available to everyone? And if so, what will we be doing that? Will we be sending it to overseas countries with low levels of vaccination?
You'd have to ask the Commonwealth that, Rachel. We just distribute what the Commonwealth provide us, and that's a question for our friends at the Commonwealth.
Is it inevitable, though, that we're going to have a lot sitting in the fridge now that you don't have to get that vaccine?
Well, not in our fridges. If the Commonwealth's got them in their fridges, you'd have to ask the Commonwealth what their plans for that are. But as we've always said, and as the world organisations seeking to deliver this pathway out of the pandemic, whilst we're all increasingly delivering more and more vaccine protection, this global pandemic is not over until such time as all of us on this planet have got this under control. So I'm pleased that Australia is part of a global effort to drive down those levels of COVID-19 anywhere in the world, particularly in our own region, and we look forward to Australia continuing its leadership role, particularly in the Pacific and neighbouring countries, to drive down the COVID-19 rates.
Do you have an update on the department's investigation into a GP handing out medical exemptions?
Yes, of course. This is GPs are largely regulated, overwhelmingly regulated by the Commonwealth through APRA and other regulatory measures. Having said that, we are assisting the Commonwealth in some of that process. It wouldn't be appropriate to go into too much detail, but overwhelmingly our GPs are doing the right thing, making sure that now distributing 2/3 of the vaccines that are now coming into Victoria, our GPs and community pharmacists are the front line of the vaccination program. And if there are any people who are going a bit rogue, that is a matter for the federal regulatory agencies, but we are working with the Commonwealth to assist them in the provision of that information.
Are you aware, though, how many medical exemptions were handed out for people who didn't meet the criteria?
So that work is underway. One is one too many, but that work is underway. It wouldn't be appropriate to comment given the regulatory measures that are available to the Commonwealth in this space.
What do you say to those who are concerned today that the Melbourne Cup's going to have 10,000 people there in the crowd before schools are back at full-time capacity and before many businesses are operating at full capacity?
Well, we've always made it clear that the safe, steady and sustained reopening of schools has been our significant priority, and I think the families of children coming back to school want to make sure that that happens in a safe way and protects those young people once they get back to school. That's our priority, and I would have thought that Victorian families and all Victorians would want to see young people back to face-to-face learning as soon as they possibly can, and making sure that when that happens, it's done in a safe, secure and sustainable way.
Should it happen though before 10,000 people can be at the Melbourne Cup?
Well, I think the Victorian community, having sacrificed so much and worked so hard to help deliver the roadmap to reopening of the national plan, expect us to be able to reopen schools safely and sustainably, and through the trial processes that the government announced yesterday, be able to reopen the wider parts of Victoria's economic, social, community and cultural activity in a way that both things can happen in a careful, staged manner. So I would have thought there would be pretty strong support for reopening schools and getting kids back to face-to-face learning as quickly as possible, whilst at the same time making sure that we reopen through the vaccinated economy trials and processes the Victoria that we all want to get back to as soon as we can.
We're going to have an event with 10,000 people at a point where a fully vaxxed person can't have dinner at their fully vaccinated mother's place, though it doesn't make much sense to
Well, I
people.
dispute that, Rachel. We know that in regulated settings throughout the global pandemic, particularly in its Australian context, that if you have a COVID-safe plan in place, that if you have the bubble arrangements, that if you have the active cooperation of responsible partners like the VRC and Racing Victoria, that you will have a safe event. What we've seen throughout the course of this pandemic, it's in private settings that we let our guard down. Completely understandable in that this is where we live. These are people that we love, that we want to bring around and share lots of experiences with. But at the same time, as we've seen in outbreak after outbreak, so many of the transmissions happen in residential and home settings. And that's the reality of the epidemiology that we've seen for month after month after month. And I think the measures that are in place recognise that and are able to get us to reopen safely, whilst at the same time wanting to minimise hospitalisations and sadly deaths and ICU admissions.
What about those businesses that are still operating under strict density limits that are looking at the Cup being able to accommodate for 10,000? I know Victorian veterans are calling for clearer guidelines on Remembrance Day gatherings, for example. Have you had much pushback from businesses?
So you covered a bit there. So firstly, we're working very closely with the RSL in Victoria to make sure that all Victorians can either in person or online have access to the important Commemoration Day events in November. And as those processes work their way through the public health framework, I'm sure the RSL will have much more to say in that regard. In regards to the general proposition of how businesses slowly and steadily come back, the same principle applies if you're a school or a business or a family. When we reopen, let's do it safely and in a manner that keeps us heading forward to coming out of the other side of this pandemic. That's why the Victorian roadmap to deliver the national plan is both ambitious but also cautious to make sure that as we open sustainably. And I think that's something that all Victorians would support.
So with the order in the way this will run, are you confident the government's got its priorities straight, that you can go to the races before you can go and visit someone, your family, at their home?
Yes, I am. 10,000 Victorians, as part of a trial of the vaccinated economy program, will be there to see the race that stops the nation, and in this instance starts Victoria's recovery. That is about 1/10 of the total capacity of that facility. So let's all keep it in perspective here. This is a safe, sustainable reopening that makes sure that our important events, our big iconic events, can go forward and demonstrate to the world that we can safely and cautiously reopen. And as the roadmap delivers more and more of its steps, as more Victorians become vaccinated, and as we drive down those hospitalisation and other rates, we need to make sure that we take those cautious steps that deliver us the Victoria we all want to get back to.
At that same time, there's smaller operators like landscape gardeners. Right now, if they're working on an occupied home, they're technically only allowed to have one person there. Is there any move to boost that up to somewhere around 5, similar to the construction workers, when we are allowing big groups like this as part of our trials?
Of course, all the public health measures are under constant review, and as each milestone is met, and as each vaccine that's put into someone's arm gets us closer to the next milestone, we continue to review all those measures. But it's always through the prism of what is safe and sustainable to deliver.
On that point, will you bring forward the planned return to schools if we do hit that 70% early, either on October 21 or before?
So of course those education, getting kids back to school has been probably the most significant priority of the roadmap. And you'll see that it's never been linked to the double dose vaccines. It's been linked to what is safe and sustainable to be able to deliver, and we've got no plans to change that.
In terms of the way that we're managing exposures at schools, we've had Year 12s back to face-to-face learning only for less than a week. Wednesday last week was when they went back. We've already got, I think, roughly 6 schools who are Tier 1 exposure sites, and they're working through close contacts. How are we trying to minimise the impact here? Because particularly with Year 12s,
Yes.
over the next few weeks, this is their last hurrah of school.
Indeed. So we saw the very successful delivery of the GAT program last week. Yes, there were some, I think, just over 30 positive cases that were emerged through that testing process. What we've learned through that process about the impact of ventilation, of social distancing within the school environment, and so far at least, the minimal transfer of the virus across those school communities, as opposed to people with community transmission bringing it into those school environments. We are looking at how we're working through that with education to make sure that the impact of the inevitable further incursion of community cases into schools is both minimised and also managed so as to make sure that particularly our VCE and higher year students are protected in that. The fact that we've got such outstanding vaccination rates of 12-year-olds and above is a significant factor that's allowing health and education to have some pretty positive discussions about how that should be managed. But of course, the kids under 12 are not able to be vaccinated at the moment, and therefore working with teachers and the school community who surround particularly primary school students is so important. And I just remind everyone in those sectors that their obligation to be vaccinated by the time they get back to face-to-face learning is so critical to protecting those kids and, of course, the adults that they rely on.
So are we getting to a point where only the kids that have been in the same, say, classroom or sitting next to someone at a desk would be considered a Tier 1 contact? Everyone else gets to come back to school after maybe just getting tested?
Well, I'm not an epidemiologist or a clinician, but the learnings that we've seen both globally and locally over the last months and indeed the last couple of weeks even in Victoria give us the real life experience as to how we manage those furloughing arrangements, how we manage those obligations about, as we've put it, the 3 Vs, the ventilation measures, the vaccination programs and the other arrangements to make sure that when those young people come back to school, they stay at school.
Sorry, can I just ask, IBAC has heard allegations that current Minister Luke Dinellen engaged in branch stacking. Should he stand down?
Well, I'm not here to run a commentary on an independent commission that has clearly now started its public hearings. That's a matter for IBAC, and I think it would not be appropriate for me to run a commentary on a live series of matters, and I won't be.
Should MPs stand down or at least step aside during this investigation, or if they are the subject of an inquiry?
I won't be running a commentary on a live IBEC process. That would not be appropriate.
IBEC has this morning had some focus on 2002 and events that occurred that year. Adam Somyurek's observed on Twitter that that's the year that both he and the Premier entered Parliament. What do you make of that?
I won't be running a commentary on a IBEC process. It would not be appropriate.
Esther said last week that they're in crisis. They're seeing huge delays in callers being able to get through to a call taker. Do you know whether they've secured any more additional support this week, or they're still experiencing long delays?
Well, all parts of our emergency responder system are under huge challenges, whether it's Esther, whether it's Ambulance Victoria, whether it's the public health system, our health services, right across the board. We've seen both huge existing demand that has been amplified by deferred care issues from 2020, then add to that the processes that both dealing with suspected COVID and actual COVID cases has slowed down the response to make sure that those patients are protected, and equally, and if not more importantly, that our frontline healthcare workers are protected. That has slowed down the entire system, and that's why we're putting enormous efforts into, whether it's Esther, whether it's the surge capacity of Ambulance Victoria, whether it's the support for our EDs and healthcare services. These are the biggest challenges that our healthcare system has faced, certainly in living memory, and we will work closely with all of those agencies, particularly with regards to Esther. I know from inquiring directly that Esther management, the Esther board and the Esther workforce are stepping up, and that there's further resources, further recruitment and further managing of the processes to address that huge demand.
Anthony Byrne has described the Labor Party as, in his words, completely out of control, and characterised it as rampant when, in terms of coercing staff to do what they don't want to do. Is that an experience you've made of the Labor Party?
No, that's not my experience, but nor will I be taking your invitation to go down the public commentary of a independent, broad-based commission's really live consideration of these issues. That would not be appropriate, and I'll resist your invitation to do so.
I don't like prefacing questions with what Sydney's doing, but has there been any more consideration to when the unvaccinated here in Victoria will enjoy some of the same freedoms as the vaccinated?
Well, as the current public health orders already envisage, we will be opening up a vaccinated economy to vaccinated Victorians. And if you choose to remain unvaccinated, you place yourself outside of that process, but you also place yourself at huge risk. And more importantly, you place your fellow Victorians at huge risk. So our public health orders and our focus on staying with the vaccinated economy processes to protect Victorians and to safely and sustainably reopen will not change.
The Premier said at the end of summer, though, yesterday. So is there more consideration?
In terms of how the public health orders are playing out now, we've got no plans to change those. The emphasis is totally on supporting the vaccinated economy plans while supporting our public health and health systems. What's going to happen in 3-4 months' time? Let's wait and see what happens in 3 or 4 months' time.
The trial that's kicking off today has got 14 businesses now. I spoke to a number of them yesterday who still weren't really sure what was expected of them, what the process was going to be. How well have we actually rolled this out, or has it all been a bit of a rush?
Quite well, and you had a number of government ministers address that yesterday. We've also seen over, as of 11:15 today, we've had over 70,000 Victorians download the new Victorian Services app and get their vaccination certificate, talking between the Vic Services app and the Australian Immunisation Register. As one of those 70,000 Victorians, I can assure you it's a seamless and very quick process. I think that speaks volumes of the desire of Victorians to want to get on and support the vaccinated economy trial, because they want to get back to the life that they know awaits us through a high vaccinated, supported Victoria.
In terms of the concert that is going to be running on the 30th of October, yesterday no one could tell me how many people will be allowed in that actual event, who's going to be running it, who's organising it, who's on the lineup. Can you shed any more light today?
Well, I see the Chief Executive of the Arts Centre Melbourne has been out making public comments this morning on that. The Sydney Myer Music Bowl is a part of the facilities of Arts Centre Melbourne. They are working through their COVID-safe plans. They're working with, as I understand it, just about every live music participant in the state wants to be a part of that gig, and I look forward to the Arts Centre Melbourne, as they always do, delivering a seamless and safe event that will be an important part of that COVID vaccinated economy trial.
Is it likely we'll see health workers prioritised for tickets?
I don't know, Rachel. I think healthcare workers are worthy of all of our support. The biggest thing we can do to support our public healthcare workers is to get vaccinated and to make sure that by doing so we don't fill up the ambulances, the emergency departments and the wards of Victoria's hospitals.
Once we do open up again, do you think it's fitting if you have more power than what Brett Sutton currently holds in terms of making decisions about what Victorians can and can't do?
So, as the Premier indicated yesterday, we're going through a normal government process of reviewing the Public Health and Wellbeing Act. That is a Cabinet in confidence process. When that process gets to the next important stage of publicly releasing those steps, we'll have more to say. As the process is Cabinet in confidence, I won't be saying anything other than that until such point as we get to that next step. But as we know, those existing arrangements are in place until the 15th of December, so we've still got some time to work our way through that normal legislative review process.
Do you think this is the appropriate approach moving forward, though?
Well, you're asking me to comment on a Cabinet in confidence process. I know the Premier dealt with the generalities of these issues yesterday, and I'd refer you to his comments.
Do we have an update on where the Mitchell Shire is at the moment? It's been a while since we've heard about them at a press conference.
The Mitchell Shire, really because of its close proximity to so much of the northern suburbs, outbreak has been in the same arrangements as Metropolitan Victoria for some weeks. I think it's got still a few days of its current declaration to play out. All the epidemiological conditions of all the areas that are in lockdown, be they Metropolitan Melbourne, Mildura, or in this case Mitchell Shire, are reviewed constantly. And as the public health team get to their point of decision making, we'll share that with the Victorian people and particularly with the people of Mitchell Shire. But we've got nothing to announce today.
Just got a contact tracing question. I know it was brought up in yesterday's press conference, but just another example of reports of lagging test results at the Alfred. A man who tested positive, it was 80 hours before he received that result. He underwent his own contact tracing system, so put his contacts into isolation. But are you aware of any issues in that regard?
Well, I'm not aware of particular cases, and if I was, it wouldn't be appropriate to comment on them publicly. But what we've seen is millions and millions of tests all being able to be overwhelmingly met in accordance with the national reported benchmarks. I think Jerome did indicate yesterday that we had some challenges with one of our pathology partners that had seen some technical breakdown in some of their equipment, and that had fed through the wider system. If there's particular cases, I'm sure we're happy to address those offline. I do know that the Alfred have been doing an outstanding job, both in the hotel quarantine areas, but as well as the direct testing that they deliver in the community that I just happen to live in. Their their success rate, their performance, their engagement with the community has been outstanding.
Minister, what do you say to Victorians watching what's happening in New South Wales today and feeling pretty deflated that we've still got another couple of weeks ahead of us, at least for any more freedoms?
Well, as we know, this current wave of the outbreak originated in New South Wales, and in terms of the support that they got quite legitimately through the best part of 1 million extra Pfizer doses at a critical part of their outbreak. We wish our friends in New South Wales every success in this important milestone for them. Victoria will reach that milestone in the very near future, and the sooner we come forward, potentially the sooner for vaccinations, the sooner we get there. In a way, what we've now got is a live laboratory of some of the issues that we will need to equally deal with when we hit that level of vaccinations to safely and sustainably reopen. I did note that whether it was the New South Wales Health Minister, the New South Wales Chief Health Officer, or indeed the New South Wales Premier, all indicate that whilst the 70% milestone for double dosing is significant, it doesn't mean that life goes back to what it was in 2019. There are still safe measures that need to be implemented, and that will be the case in New South Wales, that will be the case in Victoria.
When do you see the border reopening between the two of us then, given they're now in a much better position than us?
So you've seen over the course of the last several weeks an increasing relaxation of those arrangements. The border bubble has grown. The arrangements of turning non-lockdown areas of New South Wales into an orange zone arrangements, just to make sure that increasing movement of cases as the epidemiological conditions change comes back together. We want to make sure that as soon as we can possibly do so, that we align the conditions across both of the major states. We think that's an important measure for both states to aspire to, and we'll have more to say about that as conditions continue to change.
The New South Wales Premier and the Victorian Premier have been in discussions about this topic over the weekend, so do we have any update on where things currently sit?
Well, as I indicated, over the course of the last few weeks, we've seen consistent changes in how the border arrangements between Victoria and New South Wales have been progressively relaxed, and we'll have more to say about that as the public health advice on both sides of the river changes and as the conditions change to facilitate that.
Last question.
All good. Thank you, and I'm sure we'll see you soon. Thanks.
Yeah, well,
We're not alive to do a little talking about the